Welcome to Myo 360, the podcast, where we'll delve into all topics related to myofunctional therapy, including airway health, snoring, TMJ, tongue ties, thumb sucking, and even bedwetting. As a myofunctional therapist and a formal dental hygienist, I am sharing stories and tips to help you identify if myofunctional therapy is right for you and how it works to improve your overall health. Join us while we explore the ever-growing world of myofunctional therapy. We have one goal in mind: to help you and your family live your best life. Hello, everybody. Welcome to another episode of Myo 360, Holistic Solutions for Snoring, TMJ, Better Breathing, and Better Sleep. I am your host, Becca Rose from Myofunctional Pathways. In this episode, I would like to take you through what the experience is like to come and have a full functional evaluation. Now, there's two ways we can do this. The first way we can do this is if you're local, you can come in to my office and we will do your evaluation in person. The other option is doing this virtually. And yes, this is a very popular option. It is performed by many myofunctional therapists all over the world. What's nice about myofunctional therapy is that we don't do anything hands-on, okay? We don't need to put our hands on you like a massage therapist would need to, or a chiropractor. So that makes it really perfect for a virtual situation. So it literally does not matter where you live in the world. I have seen clients all over the world. So location is no limitation, no excuses, you guys, okay? So what happens? So usually what happens is once you find out about myofunctional therapy, your light bulb goes off and you're like, ding, ding, ding. These are the things that I've noticed in myself. And I've done all the other things and nothing else has worked or helped me. So then you want to explore this option. Typically, we would start with having a Zoom conversation where we would get on Zoom. We would have a virtual face-to-face, and you would tell me about your concerns, your symptoms, what you've tried, what you've done. And then we would have time to answer your questions about how does myofunctional therapy work? How is it going to benefit you, and any other questions you may have. So that's the first step. We have a casual conversation on Zoom. That's always free. No commitment. Let's just have a conversation, okay? When you're ready to take the next step and find out, all right, is my tongue, are my facial muscles, is facial dysfunction playing a role in my symptoms? Then we schedule the evaluation. So first thing I would do is send you a link, or you can find the link on my website under schedule. You can schedule your full evaluation right there. And then I would send you some paperwork, okay? Because we have to get established in the client portal. All right, so we would do that. Then you come into my office. And this is where we're going to really spend our time today talking about the evaluation process, what we're looking at, why we're looking at it, and then introducing you to some of the tools that I use during that assessment to help determine your oral function. Let's talk about some of the categories that we are looking at. We take lots of pictures. I will take tons and tons of pictures and videos and measurements. And then I take all these pictures, measurements, and information that I gather during your evaluation, and I put it into a pretty thorough report. I always send you a copy of that report. So you have it for your records, and you can do what you wish with it. You can share it with other providers who may be involved in your case. You can just keep it for your own record. And if you want me to share it with any particular provider, I can do that for you as well. But it's really nice that you have that full evaluation that you can look back at, and then you really understand what it is that we're assessing and how deep the assessment process is. So first off, we're going to take some posture photos. We're going to have you stand up and turn side to side, take some pictures, and then I'll have you walk up and down the hallway because I want to see how you walk, because that's a posture When we're taking these posture pictures, a lot of it is to put the whole body function together. Okay, so is your tongue playing a role in contributing to poor posture symptoms, skeletal posture? Because that fascia that's underneath the tongue that restricts that tongue movement, if you remember from previous episodes, I talked about how that fascial tissue is connected all the way to your feet. And there is actually syndrome called glossopostural syndrome, which is basically a fancy way of saying the way your tongue is affects your posture, okay? So it's important to know, though, that during this evaluation, none of these things are considered to be a diagnosis. All right. I am not a doctor. I am not making a diagnosis. But what I am able to do is to assess your myofunctional disorders and put you into the correct categories based on measurable metrics, and then report and refer as necessary to help with your case. Okay. So nothing here is diagnostic. These are all observation tools that I use to then plan your individual therapy sessions, okay? So posture. Then I'm going to be looking at your facial symmetry. I want to know which side of your face is higher. I want to know which muscles on which side of your face are stronger. And when we go through this evaluation results at the end of your visit, kind of talk about some of these things and how they're all connected, okay? So I'm looking at how you wink, how you pucker your face. What's your facial patterns like? What kind of things on your face stand out? We have ways of looking at, okay, how are your eyes shaped? Do you have lines under your eyes or on your nose? Do different muscles on your face strain when I ask you to do different movements, like click your tongue and pucker your lips and make a kissy face and wink your eyes and do all of these things? How much tension do you have on your lips? All right. And then we're looking at teeth. We also look at your teeth, not as the same way a dentist would look at your teeth, but understanding how your teeth fit together and how your tongue fits within your space that your teeth is in. That is also going to help us to understand how all of your structure and function is going together, okay? Do you have open bites or underbites or cross bites? What are all these words, right? So an open bite is something that we see when somebody has a reverse swallow pattern or a tongue thrust. Sometimes people have heard of that word, a tongue thrust. So what is a reverse swallow? What is a tongue thrust? Essentially, that means when you swallow, your tongue is pushing forward, usually against your teeth or in between your teeth, instead of being pulled backwards and engaging with the roof of the mouth the way it's supposed to. So any kind of open bite from a tongue thrust or a reverse swallow is really a big red flag for a lot of myofunctional disorders, sleep difficulties, TMJ, clenching and grinding, because that is a sure sign that your tongue is not functioning optimally. And when you're swallowing 3,000 or 4,000 times a day incorrectly, that's going to change your structure, and that's going to start moving your teeth around as you get older. So teeth, I want to know about them. Did you have braces? I look at how they're positioned. I look at if they're crowded. I look at if you have wear marks on your teeth. Do you have recession, sensitivity of your teeth? I want to know all of those things. Hard palate and soft palate. So that's the roof of your mouth. The first part of the roof of your mouth is the hard palate. The back part in the back where it's kind of squishy, and you have your hangy ball in the back, that's called the uvula. But that's the soft palate, okay? What does that look like? What are the shape of both of those things? Are they symmetrical? Do you have prominent structures on there that we typically don't see? Tonsils, can I see those? And then we do lots of different sounds. So I'm asking you to say many different sounds that engage different parts of your mouth. So when we say certain words, certain sounds, the back of your tongue should lift up and the soft palate should lift up. And a lot of times we see very weak or poor coordination of that back part of the tongue. And that can really be a strong indicator of, okay, the tongue can't seal with the roof of the mouth. The soft palate isn't sealing with the tongue, and they're not working together the way they should. I am looking for evidence of injuries on your cheeks, bite marks. Are there white lines on your cheeks? What is your tongue doing? Okay, what does it look like? There's so many different things that I'm looking for on your tongue. There's literally 20 different characteristics that I'm looking at when I look at your tongue, and that's just in how it looks. That's not even about underneath the tongue, what the tongue tie looks like, or how it's moving or how it's functioning. But there's 20 different things I'm looking for just in how your tongue looks. Okay. And then we get to the tongue tie part. I'm having you do different movements where you are stretching your tongue and you're doing different things. Your degree of tongue tie. So tongue ties go up to 4 grades. All right. There's grade 1, 2, 3, and 4. And grade 4 is considered the most severe. And that is usually when the string that I've talked about in the past, the frenum, is attached to the very tip of the tongue, and then the tongue just can't move very well at all. This is normally the kind of tongue tie we see in babies, or the type of tongue tie that most people know when you say the word tongue tie. But there are adults that have grade 4 tongue ties as well. And then I'm like, oh my gosh, how did you got this far in your life with having so much difficulty with your tongue? But we figured out, okay? All right. I also take a lot of measurements on the outside of your face, because myofunctional therapy is not just about your tongue, it's about all of your facial muscles. And like I said earlier, I want to see which side of the face is higher, which side is stronger. And then I take the measurements, and then we go back at the very end of your myofunctional therapy program, and I retake all these pictures and measurements so we can see how much improvement you've had over the course of your program. So I'm going to ask you a lot of questions about your TMJ, your muscles, your clenching, grinding, do you have popping, clicking, all of those things. And then we have different tests that we use to determine like which muscles in your face, which of your chewing muscles are stronger. We talked already about how the tongue looks. Then we look at how it moves. I want to know how your tongue is moving in all directions, up, down, side to side. We say those back of tongue words. We do suctions and tongue clicks so that I can see how everything coordinates. Is there tone in the tongue? We have to have tone. A lot of people aren't aware of that word. We hear like muscle tone, oh, I got to tone up my muscles. But what does that really mean? So you need to have tone in your muscles before you can really build significant strength. And tone is a big component of tongue health and getting ready for a future tongue tie release. I want to know how your nose works. I'm going to ask you to put water in your mouth and do different things with water and breathing and moving your face in different ways to see how well your nose is working. Can you whistle? Can you wink? Let's see. Breathing. We're going to do some breathing components. And then we get into, usually I save this for last, the chewing, swallowing, and drinking evaluation. One of the biggest end goals of myofunctional therapy is to create a correct, functional, habitual swallow every time you swallow. Now, the reason that we spend so much time on swallowing is because you are going to make new neurological connections or new neurological pathways from your muscles to your brain. It's neurologic re-education, neuromuscular re-education. And what that means is once we get your tongue strong, we get it coordinated, we get it toned, it has movement, it has range of motion, and it's not restricted any longer, then all the functional work starts to happen, okay? This is where the chewing, the swallowing comes into play. Because once you learn how to swallow correctly, from a neuromuscular standpoint, and you do it every day, you are going to do this automatically, even when you're sleeping and you're swallowing your saliva. And essentially, that is what is going to maintain your myofunctional therapy as you go through your life. So that's a pretty significant statement to make. Of course, nothing is guaranteed. We can't ever guarantee an outcome because there's a lot of factors at play. But generally speaking, if you make a new muscle nerve connection, you're going to maintain that and you're going to keep it. And then as you swallow correctly, thousands and thousands of times a day and night, you are going to be keeping your tongue strong, your muscles and your airway strong. And that is going to help maintain the symptoms that you came to see me for in the first place. So we do chewing and swallowing. I will ask you to chew something crunchy like a cracker or a pretzel, and I'll give you different instructions on what to do with it because I actually want to see you put that food on your tongue and stick your tongue out at me. And people look at me like, what? And then I'm going to have you swallow water in certain ways. And when you're smiling and doing different things, because I want to see if there's that tongue thrust or that anterior swallow pattern that we talked about before. All of these things tell me a lot about how the muscles in your mouth, in your face, in your tongue are coordinating together. Which side of the mouth do you chew on most often? No one really thinks that's a problem, but that has a big role to play as well. So we want to make sure that we can, during your therapy program, make sure we spend time on the other side, getting those muscles strong and catching up to the stronger side, okay? I'm also looking for compensations. Now, what is a compensation? Both words get thrown around. There's compensation and adaptation, but essentially what that means is that if a certain muscle is not doing the job that it's meant to do, then other muscles have to come in and help it do the job that you're trying to do. So let's take swallowing, for example. If you are trying to swallow and you have an anterior tongue thrust or a reverse swallow, and your tongue is used to pushing forward when you swallow, then most likely your neck is also going to push forward. You're going to get this like little gooseneck type of action. And your cheeks might suck in. You might tense your neck. You might tense your chin. Cheeks, chin, neck pushing forward. Those are all compensations that your body is making to help you swallow because very likely you have difficulty swallowing or sometimes even difficulty breathing while you're trying to chew and swallow. So your body moves itself in any way it has to make sure that you don't choke and to make sure that you can keep breathing. Compensations are huge. Adaptations are huge because those are abnormal muscle patterns that have been forming for probably most of your life. Again, to do jobs that you need to do to be able to survive, like eat and chew and breathe. And your body's going to make it work. It's going to move you into whatever position it needs to make sure that those functions happen because our body wants to live, right? It's going to do what it has to survive. So we compensate. And it's just like if you have to compensate because you have a bad knee. All right. If you can't put all your pressure on your knee and your muscles in your knee can't support your leg, you're going to overcompensate by using the other side of your body. It's also going to affect your hip and your ankle, and it's going to kind of go all the way up your body and all the way down your body. It's essentially the same idea. If your tongue isn't working correctly or your cheek muscles, your chewing muscles aren't working correctly, other muscles are going to help it out. All right. But then that's what causes a lot of the stress to our system and our breathing and our sleeping and our snoring and TMJ and clenching and grinding. That's what contributes to a lot of those things when there's excessive compensation over a long period of time. So we aim to try to reduce or eliminate compensations by teaching the muscles to do the job that they are supposed to do and teaching them to do that job by themselves without the other neighboring muscles helping them out. Sometimes we have to get you ready for a tongue tie release. We can't always get to the ideal outcome with myofunctional therapy if the tongue is restricted, but we talk about that a little bit more on a case-by-case basis because everyone's situation is different. So not everyone wants to have a tongue tie release. Some people come in and say, I know I have it. I need to get it done. What do we do? So we're going to figure out your situation and then talk about it from there. But the other part, and this is probably the most important part, is that I have an entire list of different providers here that we may need to work with. And some of these providers might be an ENT We might recommend that you see a airway focused dentist or someone who is specifically trained in a functional frenuloplasty or that tongue tie release that's addressing the back part of the tongue or the distal tie. We've talked about that. Link back to episode 10, where we talk a lot about the different kinds of tongue ties and how they impact different things in the body. We might recommend a sleep study. We might recommend a certain kind of scan that can actually assess your upper airway structures. We might need you to see a doctor for some reason. There's a whole list of different people, body workers, myofascial release providers, chiropractors. Now, are you going to have to see all these people? No. But might we talk about seeing some of them for certain things? Yes. Okay. It's really going to depend on your individual circumstance. So then I put all this together. Like I said, I send it to you, and then you get a copy of this report. So let me show you a couple of the different tools that we're going to use during our evaluation. So I have my little tooth model here, okay? And one of the things we're going to do is use a paper ruler, and this is going to show us your maximum opening, all right? And then I'm going to ask you to put your tongue into different positions, and I'm going to take these measurements again because I want to see how much range of motion your tongue has. And then I'm going to use a ruler on the outside of your face. I'm going to take measurements on your face in different areas so that we can assess how your muscles change over time, how they shorten. So we take a lot of different facial measurements, and it's really cool at the end to go back and see where you started and where you ended. Because as those muscles get strong and they contract, those measurements will get shorter over time, which means you have much more muscle strength and tone. I'll have you blow air on a mirror or on a phone. Can you see the shadow on there? This is a really good way for you to tell, and you can do this at home, which one of my nostrils is harder to breathe out of, all right? And those are some of the things we're looking at as well. And then the funnest part, the part everyone has a great time with, is I have you pop in the cheek retractors, and I take lots of pictures. So this is the fun part. Everyone laughs. We always have a good time when we put the cheek retractors in. And then we eat, so I told you before I would have you maybe start with some crackers or pretzels, and then we would try something chewy like a granola bar. We would take different drinks of water. But here's what I would like you to do right now. I want you to do the swallow test. And the swallow test is a really good way to determine what's my tongue doing? Where is it? Can I even do this? So what I'm going to ask you to do is take a tiny, tiny sip of water, and you're going to trap it with your tongue, and you're going to try to hold it up to the roof of your mouth. Then you're going to bite your teeth together with the water in there, smile big, and then swallow. I'm looking at your tongue very closely when you do this, because this is a really good way to determine if your tongue is pushing or trying to squeeze out from between your teeth. So try this one at home. This one's called the swallow test. And if you can't do it, or you see any pink of your tongue squeezing out through your teeth, give me a call because we need to talk. We got to fix that tongue, okay? So try that. That's the swallow test. So that is a rundown of what to expect when you come to the office for a myofunctional therapy evaluation. If you decide to do this at home and we do a virtual evaluation, I will send you a template of different photos that I'd like you to take inside your mouth and send them to me. And then we guide you through how to take the measurements. I look at the ruler, make sure that it's correct, so I can guide you through everything and see exactly what your numbers are by looking at your ruler and knowing that you're lined up on everything correctly. So if you can't pass the swallow test, then let's have do I have a tongue thrust discovery call? Okay. Find my link on my website and schedule that discovery call. That's free. And we will talk about your symptoms, your concerns, and figure out what's going to be the best option to get you in for your evaluation. And then we will go from there. So thank you all for listening. Reach out as always if you ever have any questions. I look forward to hearing from you.
now for the fine print. The information presented in this podcast is for educational purposes only and should not be taken as medical advice. We recommend consulting with a qualified healthcare professional for any questions or concerns you may have regarding your specific health condition.